fee for service has always been a terrible way to pay physicians.
Hmm.
It's, we pay doctors the same way we pay fruit and vegetable pickers, by the number of things they do over time. And, there are real limits to that. We need to have a much more outcomes-based system that bundles care together in a thoughtful way and doesn't pay to simply have you come to my office, even if you don't know. The truth is those costs of physical contact were actually sometimes pretty high
Hmm.
for the patients already, even though it wasn't an infection cost. I can remember having colleagues who had to take a half a day off work to get a prescription refilled. Well, what's that about? Well, why were we insisting on physical contact for that kind of thing? So, there's the opening up of the virtual system is something we're going to have to rebalance. And my guess is that we'll move away from fee-for-service economics and towards a better payment system that's more based on quality and outcomes. But that's a very hard thing to do and a very easy thing to say.
Yeah, I would think the defense of the fee for service model is I can measure it. I can see it and I can count it and I can measure
Absolutely.
it. And the outcome based thing counts on traceability and measurability and lots of stuff that's hard.
Absolutely. The flip on that is that um, because we were worried that modernization would allow more stuff to happen, we had been actually as a system blocking the adoption of virtual because we didn't want to make it frictionless, because we were worried about bad actors doing exactly what doing the kind of the milling thing and doing too
Yeah.
much of stuff.
Yeah.
And so, making people, there are some good studies that show that Info has done some good work on this that show that for simple procedures and simple visits, a virtual visit, either synchronous or asynchronous, what you and I would call email, can be between a fourth and a 20th as much time for the patient. So, I'm not sure that we should ever have been making people come into physical contact just so that they could get care and so that we could control the reimbursement system.